You've been a nurse for some considerable time, and the whole nursing profession has been turned on its head in that time. So what sort of changes have you seen?
I've been nursing for 37 years, and the big word for me is compassion. And I think there is a total lack of compassion in what's happening with nursing care at the moment, and that's a complete generalisation, and I know there are nurses out there who are absolutely wonderful, but the feeling that comes to me, and I hear it from other colleagues, is the lack of compassion. It's a job to be done as quick as possible, in the quickest possible time, get out and get the next job done. And I think what's happening now is actually at the centre of this is people, and the care of people has been lost. It's become tasks to be done, and that's really sad.
So you're treating patients as commodities?
Absolutely, yes. It's
yes. In fact, they're no longer patients, they're clients.
Yes, they're clients, and when I go and visit the nursing home and I ask them where a certain patient is, I'm told, oh, number 43 is in the residence lounge. Mm. And I'm thinking, well, who's number 43? You know, the patient has a name, the person has a name. Where is the individual identity of these people, you know? But that's disheartening. And is that what's going to happen to us as we get older?
I guess so. But it's not just in this country, isn't it? You told me once you had to go to Australia to look after your dad when he was terminal.
Yes, well, I went out to Australia when my father was dying. And he had major surgery for cancer, and he was being nursed in a major teaching hospital in Sydney, and you would imagine the care would be fantastic, you know, top notch. And when I got there, the ward was understaffed with nurses who were busy, or there was lots of chatting around the nurses' station. And when I went into my dad, he was upset because he was ex-Navy, very proud, and he needed a nurse, and nobody was forthcoming, there was no help. I ended up saying, look, I'm a nurse, give me the bits, give me the job, you know, I'll have to sort it out, I can't see my father lying in this mess. So I ended up getting towels, buckets, washing stuff, and treating my dad in hospital, which is not how I imagined it at all. I thought his care would be fantastic. And it wasn't. It's not unique to this country. It's
I guess you saw bits of him you've never seen before.
Well, absolutely, and that's very sad because he was a very proud man, and you know he was so desperate that I had to help him.
Yes.
And nurse him.
The role of a nurse has changed hugely. I mean, and people of your generation, if I can say that without it sounding rude, do span that remarkably well, because on the one hand you can get a patient admitted to hospital, talk to a consultant on the other end of the line as equals, and yet on the other, I remember going around to a house with you to deal with an old lady who was in a bed, and you were there rolling your sleeves up and cleaning her up, with me obviously helping by making useful suggestions every now and again.
Well, the role has extended, certainly in general practice. I mean, there are things I'm doing now that I didn't do 25 years ago. And I think that's out of necessity, because I don't think there are enough nurses going to practice nursing. They don't see it as a career choice. It's not high tech like hospital nursing or accident and emergency. And it used to be with district nurses particularly that they were practice based. They were faces that you could identify with, and if you had a worry about a patient, you could just pick up the phone, speak to your colleague and say, I'm really worried about this person, could you pop out and see them? Yes, I went out with you and I rolled up my sleeves and I dealt with a poor patient. It was covered in her own urine-soaked nightwear. I think if we'd had to refer her to the central point of contact, she may have had a visit 5 or 6 hours later.
If the same day.
If the same day, and that patient could have been my mother or my grandmother or my aunt, and you can't let it happen. You know, we just wouldn't let it happen.
But the fact that you can't talk face to face with the district nurses as we used to. Everything is done by fax.
Yeah.
I mean, that is a huge retrograde step. A call centre miles away,
Yeah.
just no personal contact at all.
No, it's so fragmented, and that is the worry, because I'm never sure when I fax to the district nurses for something urgent that they're actually going to respond to it, because you don't have feedback that they've acknowledged your fax. So you're sending your fax into the oblivion and you're hoping that someone's going to pick it up the other end and treat it with the urgency that you think it requires. And we just haven't got time to keep following up these faxes with phone calls to make sure they've received it at the other end. And it was a joy yesterday when one of the district nurses called in just to clarify on a Friday what was happening over the weekend. Today is Saturday. I don't work weekends, but I'm sitting here at Greenwood Surgery doing work that needs to be done before Monday comes. And it was lovely to see the district nurse. I could put a name to a face, I could talk to her, express my anxieties, and that was great. If I ever see her again, it'll be a miracle. If she's still employed by the current Mid-Essex CCG, that would be a miracle, because she told me that yet another member of staff has just handed their notice in.
Yeah, so it's a big turnover, and they can't get new people, because even
Yeah.
when they do,
Yeah.
they treat them so badly. They hand in their notice before they've even started. Yeah,
There's no cohesion in this health service.
Some things are better though. I mean, you're no longer the sort of handmaiden of the doctor, right? You're sort of more the you're the equal, or even the superior, in that you do some things like care of asthmatics, care of diabetic patients, much better than most doctors.
I think a lot of it depends on the practice you work in. There are practices where we do a lot of chronic disease management, and we also have a hands-on with the acute stuff. But I think there are practices where the nurses are handmaidens and there to clean up and run the errands and just do the tasks. And maybe there are nurses who are quite happy with that, who don't want to extend their role, and that's fine, because that's their choice. But in practices where you do want to do other things and have another interest and enjoy your work and finish that care of the patient, not just suggest that they need a referral, but actually complete the job, is job satisfaction.